So I think the key difference between a psychologist and a psychiatrist would be in their training and education. And that then changes the scope of practice of both those roles. So a psychologist is going to be a master's level clinician or someone that has done PhD in psychology, and their training focus primarily on understanding like psychological development. How do you look at psychological conflicts, and how does that shapes one's behaviors, emotions, and actions? Psychologists provide, an area of psychotherapy and counseling services. They also provide a lot of psychological assessments. If someone wants to get tested for ADHD or autism or other like neurological or neurocognitive, diagnoses, psychologists would offer that. A psychiatrist is someone that's a medical doctor, and then after finishing medical school, they have completed a 4 years residency training in psychiatry. And a big key difference is going to be a psychiatrist is able to prescribe medications. They're able to do a psychological assessment where they evaluate your, again, psychological conflicts, your ego defenses, and they're able to offer psychotherapy. But the key difference would be that they're able to order medications and prescribe medications. First thing I want to mention is referrals have to be patient-centered. So whoever is the referring physician has to ask the patients, are you wanting to do counseling and therapy, or are you interested in medications? So that will then change who the referral goes to, whether it's going to a psychologist or a psychiatrist. How those referrals happen, most of the referrals that we receive are going to be from primary care providers, including their PCPs. We also see referrals from ER. Someone is going into the emergency department for a crisis issue. And then we also have the ability to do self-referrals, where someone is calling our office and saying, I want to be able to be seen by a psychiatrist or get, ADHD assessment done. Referrals at My Michigan Health Center in the SUE are screened centrally. So all the referrals come in, all the psychology referrals go to a psychologist, all the medication referrals come in centrally. And, myself, I review all the referrals and then just tell them, provide them the appointment with the provider that has the earliest opening. Or you can offer all the providers and patients can choose. I do really focus on patient autonomy. I feel like the patient who is our client has the right to make the decisions they want to make, what services they want to receive. I think, it's really important to be able to provide. So when I see a patient for a psychiatric evaluation, towards the end, my biggest key is that I discuss, based on what I've talked about, and I tell them my working diagnosis for you is, XYZ, and I give them educational working diagnoses. But I also tell my patients saying, what, we met for 60 minutes based on the information that we have superficially gathered. This is what I think is a working diagnosis, but this may not be our final diagnosis. As I continue to work with my patients, diagnoses change. So I want to make sure that we talk about the fact that it's not about giving something a label. It's about starting somewhere, right? You say, what, this is where it looks like, right? And then as I continue to work with patients, that changes. So, we will sometimes, get back to what we talked about, in the beginning, and kind of work on changing our diagnoses as we get better understanding. And after the diagnosis, the biggest key is going to be offering people treatment options. And I say really like treatment options. You can say, what we can do is we can focus on, based on our diagnoses, the gold standard would be therapy. We can do therapy like for anxiety disorders. We can do therapy, and then we can look at some medications and offer them, I always look at, offering them at least 3-4 treatment options where patients have the right to choose from the treatment options. And I think that there's 2 really important aspects to it. Number one, the aspect that's important is the patients or the clients you're working with have a sense of autonomy and a sense of choice. So they're choosing what they feel works best for them. Number 2, it also instills hope. If I write a patient for a medication and they choose it, doesn't work for them, what they also know in the back of their mind, they understood those risks and benefits and they're choosing this, but also they had 3 other options. So it also instills hope along with instilling the idea of autonomy and choices. So even if the option number 1 is not working out, the clients I'm working with know that, what, this was not the end of the line for us. The doctor talked about all of these other options that we have to. I want to start answering that with the fact that I have a privilege of talking to my clients, and I am so grateful for the trust that they instill in me in talking about some really dark thoughts and so one thing I do want to start this with is that is where I have learned the most is from my patients and my clients have trusted me on this mental health journey. I'm a board certified psychiatrist. I completed my residency training in 2017 from St. Mary Mercy Hospital in Livonia. This working in the UP was my first job out of residency. This is where I have made my home and my roots. And along this journey of learning, the true impact has been my patients that have trusted me, that has shaped me to become the person that I am today. In addition to being a board certified psychiatrist, I took my addiction boards this past year. And then also that passion of my addiction boards also was driven by my patients. Being in the UP, so many of my patients I saw in mental health were struggling with a lot of comorbid addiction problems. And that is what kind of took me down that pathway. So I want to tell you that I am so grateful of the individuals that I have worked with who have added so much to my life and given and have helped me on my journey of self-growth too. So this idea we talk about is the idea of learning and helping someone. I feel like in this journey of helping my clients, I've also helped myself, and I've become a better physician and a better human in that journey too. And to tell you more about myself, so I work as an outpatient psychiatrist. I also do inpatient work. I see patients at the hospital doing a consult liaison service. So I'm a provider primarily at My Michigan Medical Center in the Sioux. I also provide services to 2 Native Indian tribes on the reservation land. I took my addiction board, so I'm also providing some addiction services at a local rehab center. My passion is women mental health, so I provide a lot of services to people in their reproductive ages, whether it is family planning, people that are pregnant have mental health issues, people that are postpartum mental health issues, people that are going into menopause, and how the female hormones affect our mental well-being.
Wow. I didn't even realize that there was a whole subsection for mental health or just for people who are family planning or pregnant and stuff. That's so interesting.
And that's interesting too, because we talk about women bodies are very unique. Not only do we have a monthly cycle, we have an annual cycle, and along with that, our hormones change through different stages of our life, whether it is with onset of puberty, onset of our reproductive years, as you incubate and give birth to children, as you become postpartum, then you have your second child, then as our bodies go into menopause, there's just so much, there's so much that our bodies, go through, and it does take a toll sometimes on our mental well-being. It's one of those, things I think we don't talk about. We talk so much about when onset of puberty happens, we go through those puberty hormones. But, for women bodies, it doesn't end there. Sometimes the process of going into pregnancy and a body incubating and, having those high level progesterones, and then the postpartum changes. Puberty happens over the course of years as we, hit puberty in our teen years. But, postpartum happens, you go to the hospital, you give birth to this child, and your entire hormone profile shifts overnight the moment you give birth. It's really interesting. We don't talk about it, but that can be deeply impactful, especially subset of individuals that have underlying mental health struggles, depression, anxiety, people that have sleep disorders. That can worsen those diagnoses in that postpartum period. Not only is it that you are going to struggle emotionally, you also are responsible for a vulnerable new infant. One thing I do want to mention is, I provide service. So where I live in the Eastern and the UP, we have 2 Native American tribes. I do provide service at Native American tribes, and we do know that Native American population disproportionately has a really high suicide rate, high addiction rate, and really high, if you look at all, as you look at, looking at the genetic or just racial differences, I feel like that is a population that I also get to service. And talking about that, it's really important when you do a psychiatric assessment that we look at someone's use of substances, someone's use of alcohol, nicotine, marijuana. It is really important because what I have found, and this may be shocking to you too, is that sometimes patients don't know where healthy alcohol consumption becomes risky use. NIAAA says that more than 7 drinks a week for women is, more than 7 drinks becomes risky alcohol use. It's really important that people understand that. And, the binge use criteria, more than 3 drinks in a sitting is risky alcohol use. And patients are sometimes astonished when you discover that data. I also want to be able to, what I want to also tell you, Abby, is we have found from research done over and over again that a physician holds a lot of they hold a lot of ability to inspire individuals that they interact with. My mentioning to a patient saying, you're drinking 8 drinks a week, at 7 becomes risky, I really would encourage you to cut down. That has a huge impact. Just saying that takes 10 seconds, but research has indicated over and over again those short office-based, interventions where you just telling a patient, giving them evidence-based advice has a big impact on our patient population and general well-being. And these research done primarily at primary care settings. So I do feel like, addiction is something that our patients struggle a lot with. It is alcohol, definitely opioids. We do see a lot of methamphetamines. I think that in the UP, I have seen more methamphetamine use disorder than I did when I worked in Livonia and Arbor. Along with it, we have also some other barriers when we talk about, being in the Upper Peninsula. We do have difficulty in specialty care. If someone has treatment-resistant depression, and I need to have them get ECT, TMS, Bravado, we have very little resources. When it comes to addiction services, we do have MAT clinics that offer buprenorphine, Sublocade, Brixadi. We do not have a lot of clinics that offer methadone, and not everyone there's a huge population that benefits from buprenorphine, but again, some do need methadone, and we don't have that resource available in at least the eastern end of the UP. Also, what I want to mention is that we do have some socioeconomic factors that also lead to some difficulty with treatment, whether they are patients that come to see me, they have depression, anxiety, but then some of the things that they're stressed about is, not making enough income to be able to provide for their family, the housing crises. Just if you look at transportation, we don't have a lot of public transportation that can be used in a daily pattern. And those resources really do impact the well-being of our community. Lack of a homeless shelter in the eastern end of the UP is a big factor. I know that Marquette has a homeless shelter, but in the eastern end, we do not even have a homeless shelter to provide shelter to patients that are not going to have housing. Sometimes addiction becomes a way of our coping, right? It's a maladaptive coping strategy when we are struggling. And what came first, chicken or the egg? Was it because we do know that patients that have mental health struggles have a high risk of using alcohol or drugs, and we do know people that use alcohol and drugs are going to have a very high comorbid behavioral health problems.
Yeah.
So it's kind of like both those things need to be looked at in a very coherent manner. Whether you end up in an addiction center, they need to look at doing a psychological evaluation, referring you to mental health services. Whether you're in mental health, they need to assess you for substance use problems and refer you to appropriate services. So I would say step number one, reach out for help. That is step number one. Just tell yourself, I'm going to get help. And that, I think, is the biggest factor. Just our mental readiness to get help changes a lot of things for us. If they're in a crisis, call 988, call the suicide hotline, get immediate help, go to the ER. Otherwise, look at the resources in your community, self-refer yourself to a psychiatrist, a psychologist. If you have to see a PCP to get a referral, get that referral. So I think the biggest step is going to be just telling ourselves, I'm going to work on this. I'm going to get myself the help that I need. And then looking at what help is available to you and going and seeking that help. And I always say that, start at whatever is the first step. First step may look like going to the ER or going to your primary care's office, seeking a referral. And from there, just sticking with that journey of mental health and mental well-being. One of the things that I just want to comment on that's really true to me, is the fact that when you're raising children, or we have partners, or we interact with others in our walks of life, that we are kind to others, because we sometimes don't see the scars and the journeys or difficulties that the people have behind the facade that we put together. So, what I think one of the precepts that I truly hold close to my heart was, Dr. Dyer, he said that when given the choice between being right and being kind. Choose kind. And that is something that I just want to make sure that we are raising more kinder people in this world. Check in on our loved ones. This world can be a tough place. If you have a loved one, you have a friend, you have a neighbor that you feel is struggling, just reach out to them. Just sometimes it's not about even asking them what's going on. It's just about being there with them, right? And I say this to my kids. I still ask them, do you want to talk about it? Do you just want me to sit with you? And sometimes that's okay. Sometimes they just want someone to sit with them.